A lot of people that own healthcare practices have thought about selling in the past, and if you're watching this video, it may be on your mind today. But then the people that start thinking about selling their practice often hesitate because they start to wonder, wait, is my practice too small to sell? And in fact, it's a reasonable question when you think about it because the majority of the headlines that you see that relate to healthcare M&A are from large private equity groups that buy regional platform businesses, practices that operate across multiple cities, multiple states, transaction value in the range of $100 million for businesses that have tens of millions of dollars in earnings. But that's not typical because the majority of healthcare practices in America are independently owned, and a lot of them may only have a few $100,000 in revenue, a handful of staff, and very simple bootstrapped operations. And if that sounds like you, that's fine, because the answer to your question is yes. You can sell your small healthcare practice, and I'm going to tell you not only who the buyer might be, but also the assets that you may have inside your practice that buyers are interested in above and beyond the profit of the business that you might not be thinking about. So one of the assets that's pretty obvious, but you might not consider, is the clinical and administrative staff. Because the clinical staff and the administrative staff are really the team that powers the operations of the business. But what a lot of buyers are going to look at is not only the core staff enabling the continuity of the business to operate in the future, but also some of the providers may be underutilized. In other words, you may have clinical staff that has a full-time salary, or you may pay them hourly based on the billable activity or the patient-facing activity that they have in the course of the normal business operations. But sometimes the providers that you have on staff, their schedule's not full. And so a lot of buyers look at that and they see the scheduling and they say, you know what, they're only seeing patients for about 15 hours a week. I think we can probably get them closer to 30 hours a week. So there's definitely some value in underutilized assets among the clinical staff and then the staff themselves. Another intangible asset that you might not consider that buyers find a lot of value in is the local market knowledge that you have about the local healthcare market, as well as the referral networks that you've built with other providers in the area. Because that creates opportunities to nurture incoming patient referral streams that can allow for growth of the business and utilization of the clinical staff. The other big one right now is the payer contracts that you have. Because a lot of the types of buyers that may be interested in your program are relatively new companies. They may be digital health companies, they may be private equity backed digital health or clinical services providers in the same clinical service areas of your program. But what you're seeing now in a lot of these state markets is that the payers, the big payers, United Healthcare, Blue Cross Blue Shield, Aetna, Humana, are really limiting how many new providers they allow into their network. And that, for a new business that's getting started and trying to hire staff and serve patients, is very difficult, because what it means is that if they're not in the network, they really can't onboard patients as well, because the patients have to pay higher copays to work with them. So they're going to try to find another provider in the network instead. And so if the doors are closed for new providers to access some of these payer networks, the asset that you have in your payer contracts is massive. And that's a really big asset that you have on your balance sheet that you might not consider. Now, let's talk about some of the potential buyers of small healthcare practices. I want to talk about the identity of the buyers that you may see in the market, as well as kind of the underlying motivation of some of the buyers as well. One of the potential buyers is actually hidden in plain sight, because one of the potential buyers may be on your staff of your business today. In other words, if you have a younger understudy, a protege, someone that's younger, hungry, a clinical director, a manager, someone that knows the business inside and out, who would be interested in taking it over in the future. Because a lot of times when you have that sort of understudy, they're invested in the continuity of the business, and they may not have the funds to buy the business all cash, but if you give them owner financing, they can give you a really good down payment, and then they can pay the rest of the purchase price out of future earnings. That's a really big one that a lot of people don't consider. Another potential buyer for a small healthcare practice is a local small business owner in the area. A lot of states in the US allow for corporate practice of medicine, which basically means, if you don't know, that you can have a non clinical owner of a clinical services business. So, not all states allow it, but those that do, there's really nothing stopping a normal civilian entrepreneur from buying healthcare practices. Now, even when that's the case, they still have to have doctors, physicians, or they have to have therapists board certified on the paperwork that have licensure that's maintained and kept up to date. So there's a lot of regulatory requirements that impact those businesses regardless. But even so, a lot of small business owners look at healthcare because it's fairly predictable, it's recession resistant, there's a big demand for these services. And so the type of local business owner that may already be operating a business or two businesses in a town or local city might see a healthcare practice as a really good way to have a service-oriented business that can drive a positive impact in that area. So a local small business owner may be interested in buying your practice. Another example of a type of buyer that is going to potentially be interested in your practice is another local practice in the area that's expanding. They may have a couple clinic locations and they may know a playbook for opening de novo locations in the area. But instead of opening locations and trying to get locations ramped up, they may look at your program and say, hey, maybe we can partner up, and instead of doing a ground up location, we can team up with you guys and we can make an investment in your business and work together under our umbrella. So a lot of these practices that might not be that big, but they might be a little bigger than your practice, and they're growing and they have sort of marketing and business systems and stuff, and they're expansion oriented, especially if they have a good reputation for clinical services in that local area, might be a good candidate for a potential buyer of your program in the future. Another type of buyer is the type of client that I actually work with, which is going to be a strategic buyer, typically an existing healthcare program that operates on a regional basis, typically in the same clinical service line as the businesses that they would be targeting. And what they're seeing is, look, like we have operations across a few different states. We know how to provide quality care. We know how this business works. But as we look to expand in new markets, we need help with staffing. There's gaps with staffing, administration, contracting, and they understand what it means to open a new location. But opening a new location in a state where you already have operations is very different from opening a new location in a new state where you don't have the operations or the local contracting with the payers. So a lot of those types of strategic buyers, instead of opening a de novo location in a new state, are going to look at smaller practices that have a good reputation, that have continuity of high quality services, that have a good reputation in that area. And they're going to say, look, I think that maybe us working together might be win-win for both of us. It may allow us to grow our team, and it may allow us to advance our mission of patient care with a provider that's already doing it in that location.